This video is on electrophoresis. Coming to electrophoretic separation of plasma proteins. Plasma proteins can either carry positive or negative charge depending upon the pH of the medium. So at alkaline pH of 8.6 they carry negative charge and they move towards anode. So depending on electrophoretic separation is based on charge and the mass. So more the charge, more will be the mobility of the protein, and more the mass, less is the mobility of the protein. So when compared to all other plasma proteins, albumin is the fastest moving protein because of its low molecular weight and maximum charge. Next is alpha 1 band represented by alpha 1 antitrypsin, alpha 1 lipoprotein, retinol binding protein, thyroxine binding globulin, alpha beta protein, and corticotropin binding globulin. So alpha 2 band is represented by alpha 2 macroglobulin, haptoglobulin, ceruloplasmin, transcobalamin. Beta band is represented by beta 1 lipoprotein, beta 2 microglobulin, transferrin, hemopexin, plasminogen. The gamma band, which is the slowest moving band because of its heavy molecular weight, is represented by immunoglobulin and C-reactive protein. Coming to clinical significance of plasma protein. So the first image represents the normal electrophoretic separation of plasma protein, with the fastest moving band being the albumin, followed by alpha 1 fraction, alpha 2 fraction, then beta, and lastly the gamma fraction. So in chronic infection and in cirrhosis, there is increased globulins due to reversal of AG ratio resulting from decreased synthesis of proteins. So this is the widened gamma globulin band, as you appreciate in the image. So next is nephrotic syndrome, characterized by increased alpha 2 macroglobulin. This is because of loss of all low molecular weight substances in urine due to damage to renal glomerular basement membrane. So next, the electrophoretic separation is of great use in multiple myeloma, where we get to appreciate the M band in the gamma region. Now this M band is due to excretion of Bernstone proteins, which are light chains of immunoglobulin, either IgG or M. Now here we need to differentiate whether the sample used is serum or plasma. So if we get to appreciate the M band when serum is used, it is indicator of multiple myeloma. So when plasma is used for electrophoresis, so we get to see again a band in the gamma region, and this represents the fibrinogen. So here appropriate choosing of sample is very important. So plasma band in gamma globulin region is indicative of fibrinogen, and when serum sample is used and we get a band in the gamma region, it is M band, indicative of multiple myeloma. Coming to separation of hemoglobins, based on their charge and mass, hemoglobin can also be separated, and this is of great use in differentiating different types of abnormal hemoglobins. Now the first image represents the normal hemoglobin separation, with the adult hemoglobin moving faster, and it represents 95%. So a broad band is seen, followed by fetal hemoglobin of 2%, hemoglobin A2 of 2%, and this is the origin which represents the carbonic anhydrase part. So this can be used, hemoglobin electrophoresis can be used to identify patients with beta thalassemia, where there is abnormal synthesis of globulin chain, both the homozygous state and the heterozygous state. And this thalassemia is characterized by decreased adult hemoglobin with increased hemoglobin F and increased A2. So the more the increased A2 and increased F with very little A indicates, adult hemoglobin indicates it is beta thalassemia major or the homozygous state. So hemoglobin electrophoresis can also be used to identify sickle cell trait and sickle cell anemia. Here there is in sickle cell trait, there is decreased A1, uh, presence of F, and characteristic S band also is there. So in sickle cell anemia, what happens is A1 is totally absent, there is increased F, and there is characteristic S band suggestive of sickle cell disease or the sickle cell anemia, caused due to mutation in beta chain at 6th position, where valine is replaced by glutamate. Now, lipoproteins can also be separated using electrophoresis. Now, this is the characteristic electrophotogram where a combined electrophotogram of lipoprotein and albumin is represented in this image. Here, the chylomicrons, which are heavy molecular weight substances, they have the representation at the gamma region. LDL is represented at the beta region. Pre-beta is represented by VLDL, and HDL represents the alpha 1 region. Now this is of great importance. The electrophoretic separation of lipoproteins of great importance in identifying different Fredrickson's hyper and hypolipoproteinemias. For example, in type 1 there is increased chylomicrons. Type 2 there is increased LDL band in the beta region is seen. In type 3 there is increased IDL band in the pre-beta region is appreciated here in this image. Type 4 there is increased VLDL band in the pre-beta region, and type 5 there is increased VLDL and chylomicron. So with electrophoresis, even the lipoprotein subfractions can be separated and can be used to identify different types of Fredrickson's hyperlipidemias. Electrophoresis of nucleic acid can also be done, and it has got wide variety of clinical applications. Now it is used along with PCR to identify the successful amplification. Electrophoresis of DNA is used in DNA purification for isolation of specific DNA fragments. It is used in DNA fingerprinting to identify the individuals in medical legal cases or identify the paternity in disputed paternity-maternity cases. Restriction mapping, where the analysis of DNA cut by restriction endonuclease enzymes is used. So it is also used in sequence preparation for preparing DNA for DNA sequencing. So these are the clinical applications of electrophoresis of proteins, lipids, hemoglobins and DNA.